Warning, this content may be upsetting or disturbing to some audiences. Woman managed to mistake fake fingernail glue for her eye drops on her bedstand. She glued her eye shut. Doctors, what's that one case that made you go, "I'll never see that again"? Try not to cringe at the last story. I've cared for two people with locked-in syndrome over my career. One young man due to a rapid overcorrection of sodium during surgery, and the other a young woman who had a hemorrhagic stroke from high blood pressure, then had an embolic shower that stroked her pons preoperatively. He partially recovered over months and months, but pretty much lives like an incomplete quadriplegic now. Needs full-time home care. She could only move her eyes straight up and down. She communicated with us with a letterboard and moving her eyes up or down for yes or no for more than a year before deciding she couldn't live like that and decided to have physician-assisted death. Had this 36-year-old woman come in on a wheelchair, was over 300+ pounds. She hadn't gotten up in literal months, and her family was giving her food, water, etc. She tried getting up and according to her immediately fractured right upper leg, and left ankle. From the looks of it, it seemed like they had already been like that for a while. They healed in their broken state. She finally admitted to trying to break them again because of the pain and had her kids ram crap into her. She had food wrappers shoved into cuts on her arms, to stop the bleeding and had full cataracts in both eyes. The cuts didn't look deliberate as some were places she couldn't reach, also the wrappers were mostly wrappers from some hot dog place. The wrappers weren't fully inserted. Nearly every cut was fully healed as it could be anyways, with wrappers still there. She did have type 2 diabetes as well. 3 of her toes were completely black on the right side. Honestly, I was just amazed to see her not screaming from pain. Anesthetized a guy who tried to kill himself with a rifle, but when he reached down to pull the trigger it changed the angle and he blew his face off instead. He looked like the Predator. It was his 3rd failed suicide attempt. I hope to never see it again, but I understand it's not rare. Some years ago we had this patient that was diagnosed with breast cancer at an early stage, pretty treatable. She wouldn't even need a mastectomy, just a lumpectomy plus radiation, not even chemo. Well, after some advice she got from some holistic healer, she backed up on the surgery and refused any treatment since her healer had told her cancer is the result of keeping a grudge on things and medical treatments were a scam that were colluded with the big pharma. Her whole care team tried to put some sense in her head to no avail. Even the head of surgery tried to convince her, the social workers, the priest of the hospital chapel. She said no. Fast forward a year and a half or so later, she comes back to the ER with a terrible fever. The smell gave it away. Her breast was no longer there, it was just an open, bleeding mass producing pus with maggots in it. She went to the ER after her husband begged her for it. She was still convinced her healer could cure her. Scans showed it had spread everywhere. She passed away a month later. She was 35 and left 3 small kids and a heartbroken husband behind. Women managed to mistake fake fingernail glue for her eye drops on her bedstand. She glued her eye shut. We eventually eased it open using petroleum jelly and some simple tools, cotton swabs etc. Once open, her vision was unaffected and her kids berated her mom, "You're such an idiot." The petroleum jelly is not an antidote, but just a way to lubricate while we safely and slowly pried. And yes, I somehow saw it again. Second patient who had it, a little kid with even more glue, so it was a scarier event. The eye wasn't totally shut, so we knew tears could get through, which means no chance for blockage. In that case, we were unable to open, so we provided an eye patch and said, "You're a pirate now." That last part isn't true. In reality, they just had to wait the few days till the glue wore away and the body generated new skin below, kicking off the old skin with the glue. The child was okay in the end as well. I think one of the most interesting things I ever saw in the emergency department was the opposite of an episode of Untold Stories of the ER that I literally saw a few days earlier. The patient in the episode is labeled as being psychotic, as she said something was crawling in her head. The doctor listens to her story and indeed believes his patient to be acutely psychotic. It was the physical exam that revealed that a botfly laid eggs on her scalp and they had to remove multiple insects from her scalp by using Vaseline to suffocate the bugs enough to extract them. My patient unfortunately had the opposite. She was a highly respected member of the community. She went on a holiday and got worms in her vag. The gynecologist confirmed it for her under a microscope. Once the diagnosis is made, you are easily treated. She was given the requisite dosing of, I think, mebendazole. This is a one-time dose and sometimes you need a second to cure yourself 2 weeks later. Unfortunately, what the patient presented with was an acute psychotic break. She stated she had worms coming out of her skin. The only way to get them was to chew walnuts and rub the chewed walnut paste against her skin to extract the worms. She rhythmically rocked in the bed while her husband sat by. She couldn't stop rubbing walnuts and saying, "See, there's a worm." This went on for hours while we ran lab work, CT scan of her head, drug screen, even sent walnuts worms for pathology. No positive results. Eventually I had to admit the patient. The husband looked so defeated. I didn't feel comfortable with him having the strength to care for her. Don't know if I'll see that scene again. I only saw the aftermath, but this happened when I was a student nurse and got the story from one of the physios there at the time. Guy came into the emergency room at the hospital. I was completing my training with a dislocated hip. So with the whole team and a number of med and physio students, they went to put his hip back into place. They've done this, and then the guy just started screaming in absolute anguish and pain and continued to scream and scream till his voice box gave up, and he just screamed silently until he passed out from the pain. Doctors found on closer examination that one of the patient's testicles somehow got in the way and ended up being squashed like a pancake. Inflated like a balloon from the hand. She worked at a machine that made plastic bottles. A hollow spike with a blob of melted plastic is jabbed into a mold and it injects air until it reached a preset cutoff pressure before the mold opened. While cleaning the machine cycled and caught her hand. The spike kept injecting air, but never hit the cutoff pressure, so it kept injecting. Fortunately it didn't hit a vessel that would kill her. Instead the air dissected in the fascial planes and subcutaneous tissue and blew her up, free air in abdomen, both lungs partially collapsed, looked like a volleyball. We reinflated her lungs with chest tubes, gave her antibiotics, but she was fine otherwise. The rest of the air absorbed over a few days. Saw her in the office and she was a tiny thing, unlike the huge obese person I had suspected on discharge from the hospital. I don't know if this is a rare diagnosis, but certainly very creepy and interesting. Mid-30-year-old male presented to the emergency department with black ears and nose. It looks almost like the tissue is dead. His ears are crunchy when you palpate the skin. There are other areas of blackened skin. The guy admits to crack cocaine use. What he had was vasculitis, inflammation of his blood vessels. Because for whatever reason drug dealers cut cocaine with an antihelminthic, worm drug, called levamisole. The skin goes black and the treatment ultimately is, stop smoking crack. I admitted him. The following week I see the patient's name on the board again with urine retention as complaint. He didn't stop smoking and now his penis became black. The urologist placed a suprapubic catheter, a catheter through the abdominal wall and into the bladder, instead of one through his penis. Don't Google image search this. A good friend is doing residency at a pediatrician's office that had a 6-month-old girl brought in because she had started growing pubic hair. Not fuzz, straight up pubes. A nurse took note of the fact that the father was in his 60s and had enough insight to ask if he was taking testosterone treatments. Turned out that during skin-to-skin time he would lay his daughter on his chest, in the same spot he had applied his testosterone gel earlier in the day. When I was on a gynecologist rotation, I saw a patient who needed a hysterectomy. A few days post-op she had a mild fever and abdominal pain. Ultrasound showed a collection had built up where her uterus used to be, so she was scooted back to theater to try and drain it. So the surgeons are carefully trying to reopen the wound, and not much is coming out for a while. Suddenly a literal waterfall of pus starts gushing out of her vagina. There were liters of pus that had collected in this woman's abdomen and it was now spilling onto the floor of the theater. It looked like peri-peri sauce and smelled like death. 70-something-year-old lady at normal health, walking, reading, enjoying life with husband, a month or so prior to arriving at the university hospital where I was a resident. In that month she had rapidly went blind, vision was first symptoms. Optometrist said everything was good, and no longer spoke nor ate. Husband distraught, obviously. Diagnosis of sporadic Creutzfeldt-Jakob disease. The human version of mad cow disease or scrapie. When I was a med student there was this lady who was admitted with shortness of breath and she was not conscious due to COPD and pneumonia. She looked old but not that much. So when she woke up, resident was taking the history and looked surprised. He said, "Are you really 106? She said yes, but it might be wrong, 2 years give or take. And resident asked if the old man was still around. She said he passed away 1.5 years ago. When we asked how did he pass away she answered. He was 115 when he died. His senses were getting weaker and he was not feeling well, so he was moving very slow. So did he have a heart attack or something? Nah, he didn't hear the bus when he was crossing the street and died from traffic accident. She had really old daughters taking care of her, but they weren't very old looking either. Also, she was upset because we didn't let her die. This lady came in and literally half of her face had been basically eaten up by basal cell carcinoma. Eyes and everything were just gone. It was oozing blood. It had been this way for years, according to her. And the kicker, that's not even the problem she came into the hospital for. She had come in for an umbilical hernia as big as a basketball that had been there for months, and she'd started vomiting over the past week, so she finally went to the ED. As an anesthesiology resident, I anesthetized a guy who ended up having full. A colleague told me her mom, who's a gynecologist in a small town, once had a patient who had inserted a salmon into her vagina. When she tried to take it out, the scales dug in and it got stuck. I once had a 4-year-old boy come in who'd been run over by a runaway riding lawnmower. The medial side of his leg was sliced off groin to toes, and some toes were hanging by the mere skin. The femoral artery was exposed for decimeters, the mower just missed it. I asked an experienced colleague to come in and help me, and he said he'd only seen something like it once before, when he had a patient in Africa that was bitten by a lion. Nurse here. Got a patient from the ED. While she was down there, the nurse noted that her shirt was wet. She was assisting the patient into a gown, and when she removed the shirt, there was an open stage 4 breast tumor there. The wound's about the circumference of an apple or orange. The doctor asked her, "This doesn't just happen overnight, how long has this been going on?" The patient had no idea. This woman was definitely weird but didn't appear to have any psychiatric diagnosis. She lived with 2 brothers who obviously didn't have any reason to be looking there. She's probably dead now. My dad used to work in the ICU about 40 years ago. A farmer came in who had all his skin ripped off by one of those high-speed belts. Surprisingly, he wasn't really concerned about that. The first thing he said to my dad was, my genital, is it still there? I just got married and we plan on having kids." By some miracle, the only place where his skin wasn't ripped off was around his genitals. Working in the imaging department, I've scanned a ton of nightmare scenarios. Had a kid who apparently shot himself in the heart with a nail gun, and you could actually see the nail pulsating with each heartbeat. Aside from that, I've seen the usual objects stuck inside people. Usually it's with prisoners who just want to get out for a couple days, so they'll swallow batteries, combs, etc. Back when I still did X-ray, I had a girl who was driving with a pair of metal tweezers resting on her leg, until she got into an accident, and all of a sudden they went from being on her leg to in her leg. The crazy thing is that she didn't even realize they were in there until I brought it up. Then she started yelling at her boyfriend for no reason, like it was his fault. And of course I'll get the occasional hot sauce bottle shoved way too far up the butt. Good times. The girl who came in with her ribs resembling the aftermath of a bull in a china shop, essentially the closest thing to DOA you can have. She ended up walking out of the hospital a few weeks later as if she hadn't had half her body ground into near paste. 99% of patients would have been dead before hitting the hospital, much less make almost a full recovery. A young, very obese woman who came in for sepsis. The source was a bunch of wood splinters embedded in the skin under her penis, but no one could figure out how the splinters got there. Eventually the story came out. The woman needed help whenever she tried to have penetrative sex with her husband, which they only did to try and conceive. She'd lay down on the kitchen table, her mom would hold up one leg, her mother-in-law the other leg, so she was essentially in lithotomy, and her dad would shove a board under her penis to hold it up to allow her husband access. Apparently they called it the breeding board and decided to sand it down before using it next time. This one guy walked into the ER with a priapism. For those who don't know, a priapism is an erection that cannot subside on its own for several hours. It can be due to damage to the spinal cord, sickle cell anemia, cocaine, Viagra, etc. They need to be treated right away so as not to become necrotic from lack of oxygen. This guy had no risk factors, but for some reason just started getting them. He had 3 in the past 4 weeks. So when he walked in he already knew the drill. The ER doc I was working, I'm a med student, with at the time had only ever drained one before, but he thought it would be good practice for me to treat this once-in-a-lifetime medical condition. I'll never forget the look in that guy's eyes as I held his erect penis in one hand and then immediately stuck a needle in it. Basically, you insert the needle to the corpus cavernous of the penis, which is on the dorsal aspect. Then you pull back the plunger to suck out a good amount of blood. I don't remember the exact amount we aspirated out, but it was a good amount. Then you inject a vasoconstrictor into the penis to prevent more blood from just flooding back in. Thanks for listening to Radio TTS. Hit the subscribe button and activate the notification bell for a free plunger to suck out blood of your swollen anyway. Click the right box for the doctor's playlist. Let us know in the comments what you think about these stories.